Welcome everyone to our summer webinar series. We're just getting ready to start here in just a couple of minutes. We're excited for our summer webinar series tonight. I've got my right-hand man Travis here with me today. He's my technical assistance guy.
Hi everyone, my name is Travis Mills. I'm an outreach coordinator. I work at the Nevada Center for Excellence in Disabilities. Nice meeting all of you. Thank you.
Great, and we're just getting ready to start. We have our speaker here, and I'm Diana Rovetti. I'm at the Nevada Center for Excellence in Disabilities, and I'm doing this webinar series on behalf of the Nevada Division of Public and Behavioral Health under the Children and Youth with Special Health Care Needs. And I'd like to welcome Mr. Cassius Adams, Public and Behavioral Health. Would you like to introduce yourself, Cassius?
Good evening, everyone. My name is Cassius. I am a Children and Youth with Special Health Care Needs Coordinator for the state of Nevada. So I'm happy to see you all here tonight, and I'm happy for the webinar. Thank you.
Thank you. Okay, and now the time you guys have all been waiting for, we have Laurie Bauer here with us. She's a registered nurse, and she's the Katie Beckett Healthcare Coordinator for the state of Nevada. She's been working for the state for 16 years. She's had a lot of experience working with families, and she is a wealth of information, and I think you guys are really going to enjoy this and get a lot out of it tonight. Laurie has 3 sons, and she loves to snow ski, so there's some fun little facts about her. And with that, I think I would like to turn the time over to Laurie.
Thank you, everyone. I want to thank Diana and Travis and Cassius for having me be here tonight to speak to all of you. Basically, just to share with you about what the Katie Beckett option for Nevada Medicaid is. And really tonight is to make it accessible and easy for you. I'm going to give you my direct contact information when we're done, because my job is to help make it easier for all of you to access this information and walk you through it and shepherd you through the process if you do decide to apply for Katie Beckett. Because like with many programs, it's just not easy in the beginning to get started. My colleague, Tonya Blockowiak, is not here with me tonight, but she is also my supervisor, and you may very well talk to her too as well in the future. I'm going to try to change and share. I want to share another screen because I think before we start about what is Katie Beckett, I want to talk to you about who is Katie Beckett. Can you all see that picture?
Yes, we can see that.
That's Katie Beckett in the middle, walking with her wonderful advocates, her mother and her father. And this is who Katie Beckett is. I'm going to read to you a little synopsis from 2 articles. One's from the National Public Radio, which ran on May 21st, 2012, and another one from the New York Times, May 22nd, 2012. Katie Beckett was born in Iowa in 1978, and at the age of 5 months old, she developed a brain infection that left her with partial paralysis. Afterwards, she required a ventilator to help her breathe for much of the day. And at that time, in 1978, Nevada Medicaid couldn't pay for this type of expensive treatment in a hospital or a nursing facility setting. Katie's parents were amazing advocates, and they were the force that eventually led to President Reagan hearing about her story. And President Reagan championed her cause and worked to change the rule so that Medicaid could pay for this type of care in the home setting. There's President Ronald Reagan hugging Katie Beckett and her mom and dad, who worked so hard to bring her home because she spent the first 3 years of her life in the hospital that she was born at. So it was through this work with the Tax Equity and Fiscal Responsibility Act of 1982, which Ronald Reagan championed, or TEFRA, that made it possible for Medicaid to start paying for expensive services like ventilator dependents, et cetera, in the home setting. And it's cost significantly less to care for children with medically fragile or developmental or intellectual disabilities in the home setting. It's about 1/6 as much, costs about 1/6 as much for her care in the home setting as it did in the hospital. Katie went on to college and she earned a college degree in English and creative writing. She actually applied to graduate school. She wanted to become a teacher and she was writing a novel. She lived independently on her own and had her own apartment through her 20s and 30s and held several jobs. And Katie and her mother Julie became national advocates for people with disabilities. In May 2012, Katie died unexpectedly at the age of 34, but she lived more than 3 times the age that her doctors had ever predicted that she would live. Part of me thinks it's probably because she was home too, you know, in her home setting with her family and her community, that she was able to thrive and remain well and healthy. And so this is who Katie Beckett is, and this is how we got the Katie Beckett option. And that TEFRA allows Medicaid to pay for care that would normally be given in a nursing facility, hospital, or intermediate care facility for the intellectually disabled. There are 19 states that have Katie Beckett Medicaid. The Catalyst Center keeps track of the states that have Katie Beckett Medicaid options, and you can contact me if you're interested in getting that website so that you can look. It's important to realize that Katie Beckett, this eligibility option, is the last way that a child can qualify for Medicaid. The Katie Beckett Medicaid is full fee-for-service Medicaid, and it covers hospitalization, outpatient and inpatient care, physician services, medications, vision and dental care, as well as medical transportation, non-emergency transportation, and that includes air flight and meals and lodging as well. So how does this all begin, basically? How it starts is a family needs to apply for Social Security for the child. And if the child does not qualify because his or her parents are over income, then, and to say if they did qualify under SSI, you would still receive fee-for-service Medicaid, which is the same Medicaid as the Katie Beckett option. Again, the Katie Beckett option is just the last way that a child can qualify. So if you apply for SSI and you're accepted, you will have fee-for-service Medicaid. But if you don't, because you're over income, then you would apply for the Katie Beckett. Now, the other requirements for the Katie Beckett option for Medicaid is that the child would need to meet a level of care that would be provided in a hospital, a nursing facility, or ICF-IID, which is an intermediate care facility for the intellectually disabled. And a physician, we have 2 physicians on staff. We have a pediatrician and we also have a psychologist. They work together in tandem, and they will review all of the documentation that we obtain, and they're looking to see that the child meets a disability criteria under the Social Security Blue Book guidelines. The other important thing to remember is that Medicaid can never pay more than we would pay if that child was receiving care in a hospital, nursing facility, or ICF-IID. And this slide shows that. So here you can see, and this is just an example, these change, this grid and the amounts change periodically due to, changes that happen for income and things. But you can see we have our nursing facility standard level of care. We have a nursing facility ventilator dependent level of care, a nursing facility pediatric specialty care 1, nursing facility pediatric specialty care 2, and the intellectual care ICF-IID level of care as well. All of these level of cares are determined by your Katie Beckett case manager, whether those criterion are met. We always try to do our very best to make sure that we can get an application to the doctor to evaluate. So we staff a lot of our cases. It's very complicated to meet level of cares for young children because there aren't very many milestones, like for infants, for example. it's very tricky to get an infant to meet a level of care because they just haven't had enough time to not meet any milestones. And they're dependent for most of their care. So that is one of the drawbacks and one of the things we struggle with. So sometimes it's hard, but we use all of our resources, we use all of our nurses and all of our social workers. If we're struggling to get a child to meet a level of care, we staff them as a team. So that child family has the wealth of, multiple nurses and social workers looking at this case to see if we have missed something. We just basically don't want to miss anything. We want to get these applications to our physicians to have the physician determine whether or not the child will meet. The only level of care that is not currently handled in the Medicaid district office is the ICF IID level of care. Those are currently performed under the regional center. So Rural Regional Center for the rural, Sierra Regional Center for Washoe, and Desert Regional Center for Las Vegas. Eventually, that level of care will also come to the district offices because our nurses and social workers are very familiar with doing these level of cares, and it just makes sense. And it will take one other agency out that the family will have to interact with on a regular basis. So it's to help streamline things and make it a little bit easier for families, especially in the beginning. There is a parental financial obligation, or PFO, involved with the Katie Beckett option. It is currently under a moratorium, so we are not collecting that PFO. We have rewritten our chapter. It's been approved by legislature, but we're going to be going to public hearing in the near future. And I promised Diana that when that public hearing will be held, we will let her know so she can reach out and put that out there as well to the community so that you can attend that and be involved. And the amount will no longer be determined or collected by the Division of Welfare and Supportive Services. It will be performed right here within the district offices. It's going to be more like a co-payment based using annual income your taxes basically. And it's going to be based very much like Nevada checkup. Nevada checkups co-payments are based. We don't want the co-payment to be a barrier to families accessing the Katie Beckett option, because we know that children with severe medical problems and with developmental and intellectual disabilities are best served when they have the most access to healthcare and insurance possible. So that's our goal in the district office in Nevada Medicaid is to make the Katie Beckett option not another barrier. So how do you start? How do you apply for Katie Beckett? It starts again with applying for Social Security, and you're going to be applying on behalf of the child. If you are denied based upon your parental income, you're going to contact me. You're not going to do these things because it's really difficult to navigate. You'll contact me and I will send you an email that has all of the attachments that you need to apply for Social Security. It will have the Medicaid Aged, Blind, and Disabled application on there. It will have Katie Beckett written on all of the pages. Unfortunately, we are not able to get that Medicaid Aged, Blind, and Disabled application to have a box on it where parents could easily check off Katie Beckett. That's not an option. So we're relegated to doing it this way, but I'm hoping that if we continue to do outreaches like this, that it won't be a barrier. And I promise you that I'll get you through the process. It's really important when you fill out that Medicaid Aged, Blind, and Disabled application from welfare that you don't leave any blanks. You're going to be answering the application like you were answering it for the child, except for there's a section for parents and people living in the home. And that's where you would answer like you would like their parents. All applications for Katie Beckett go to the Craig Road address. And here's another thing that's kind of confusing, that Medicaid aged, blind, and disabled application. It has an actual PO box written on there. And if you send the application to the PO box, applications typically get lost. So we do not want you sending it to the PO box. We want you sending it to the Craig Road. And that's why I really want you to talk to me so that I can help get you in the right place and get everything where it needs to be. We really recommend that you do certified mail with delivery receipt. It's a little green postcard. You pay a couple extra dollars to have that, but there's a reason for it, because eligibility for Katie Beckett starts after you're approved. It will be retroed back to the date that that application was received. So that will be the date once your application is approved by our disability physician. That will be the date that the Katie Beckett Medicaid eligibility will go into effect. We do also have retro eligibility for prior medical, and you can go back 3 months from the date that your application was received in welfare. And that's very helpful for families who are, have a child in the hospital per se, and bills that they're getting. So you can go back 3 months and we can help you with that as well. Yeah.
With this slide right here, can you tell us how recent your SSI rejection needs to be to apply?
That is a really good question that I do not know the answer to. I will have to find out and get back to Diana so she can post that. I do believe that it's fairly recent. I tend to think it has to be 6 months, possibly, but I'm not 100% certain, but I will look that up and get back to Diana on that.
When the new PFO process is finalized, does that mean DWSS will be removed from the process entirely and paperwork will not be submitted to their office anymore?
Unfortunately, no. You'll still be involved. They're going to be involved with, because they do the eligibility determination for Medicaid. So you will need to still work with them for your initial application, and you will be receiving redetermination paperwork, I believe, every year from them, and it will need to be sent back to them. The good news is you will have a worker. His name is Sal Savini, and you will be dealing directly with him, and he's wonderful. So it will make it a little bit easier.
I am the waiver coordinator for RRC/SRC. Can I still fax the apps to the Craig office?
You can fax them, yes. And I don't know if I can't. You want to fax applications for Katie Beckett? Is that what you're asking?
Okay.
Yes.
Yes, you can fax them. It's really important not to exceed their maximum allowance of paper. I think there's like a limit of like 20 some odd pages per fax. We have actually caught their fax machine on fire before.
Oh boy.
So yes, you may. And I would put it attention Katie Beckett intake. And I actually would like to send Diana the correct fax information too, so everybody has that as well.
Is there anyone available to help a parent fill out the application? Does Sierra Regional Center do that? And how long is it currently taking to get approved?
I will help you. I'm happy to do, hands-on help via email, via phone. I'm happy to help you get that MABIT application filled. I do believe, as Rural Regional Center chimed in, they also help. And Diana has also assisted families as well in completing the MABIT application for the Katie Beckett program.
Yes, and the Family Navigation Network here at the Nevada Center for Excellence in Disabilities is really good with that as well.
And I think Rural Regional Center always knows that I'm available to help them as well as they're navigating if they have questions. And Diana and I have collaborated extensively before to get applications through. I think one of the questions was, how long does it take? Was that a question?
How long is it currently taking to get it approved?
Well, the whole Katie Beckett process, and I'll talk about that in another slide. One of the drawbacks is that it's not quick. It can take 60 to 90 days, and that's one of the drawbacks. It's not fast. However, I have been successful in getting applications done much quicker. We've expedited things when children, are in the hospital, and we need to help them, but it isn't a quick process, unfortunately. One of the most time-consuming parts of the process is medical record gathering. So really recommend that parents with kids with medical problems or developmental or intellectual disabilities, especially if you're connected to Nevada Early Intervention Services or ICANN, make certain you keep all of your records from them and all of your records from your pediatrician and from any specialists that you see. It's very difficult for us to get records from Stanford. We are even now struggling to get records from Renown. It just takes a lot of time, unfortunately. So once welfare, the Division of Welfare and Supportive Services, has received all of the paperwork that they require and all of their eligibility processes are completed, then they forward the packet to the Nevada Medicaid District office in the geographical area of the recipient. So we have an office in Reno, we have an office in Carson City, we have an office in Elko, and we have an office in Las Vegas. Then the supervisor for the Katie Beckett program in that office will assign a healthcare coordinator to the case. And that healthcare coordinator is either a registered nurse or a social worker. We typically use registered nurses for the pediatric specialty care and ventilator cases, but our social workers are also, very adept as well. The paperwork then begins for the Katie Beckett process, the Medicaid process. Then you'll get a Katie Beckett home visit questionnaire. It's an 8-page questionnaire, and it basically starts from the mother's pregnancy, and it's basically a history tool of that child. There's a consent for release of information, a physician's statement, which is a certification. I will share with you that currently, unfortunately, it requires a physician's signature. We are working on, because most of our care is no longer given by physicians, it's done by nurse practitioners and physician's assistants. And we are working to get the verbiage changed as well as we rewrite that chapter. We need medical records for the past 36 months for our physician to be able to evaluate to make sure the child meets a disability criteria under the Social Security Blue Book guidelines. And if that child is of school age, we'll also need their current IEP, their individualized education program. And there's a teacher's questionnaire as well for the child's teacher to fill out. Once all of that information is collected and received back, we schedule a home visit. And currently, under the pandemic, we're doing our home visits via telephone. I've been notified that potentially September 1st, we're going to go back to pre-pandemic business as usual, and those visits will again become home visits as well. When that home visit, then the Katie Beckett Healthcare Coordinator is going to check to see if that child meets a level of care. Again, either the nursing facility level of care or one of the pediatric specialty level of cares or FIID level of care from our regional centers. When we're doing these level of cares, we're basically looking for deficits in activities of daily living and in milestones. And we're comparing that child to a child who doesn't have that diagnosis or disability. So once we get all that done, the level of care is met, the healthcare coordinator will type up a home visit narrative, which is a very organized and very detailed assessment of the child's history. And then all of those documents and medical records are submitted to our physician for the Social Security Administration review. Basically, they're going to use those Social Security Blue Book guidelines to see if the child meets a disability criteria. We're also working to change the lengths of time for our disability criteria so that they match what Social Security is doing. Currently, our disability periods range from 1 year up to 3 years. We notify welfare when a child has been approved. We also notify the parents as well. And welfare will send out that welfare, the Medicaid card that you will get is that child's card. That number will be the child's card for his or her rest of life, even into adulthood. So always save the card. Don't ever throw it away. Even if you go off of Katie Beckett, still keep it, because welfare is no longer going to be assessing for the parental financial obligation.
Laurie, when you said disability approval ranges from 1 to 3 years, does that mean that's the amount of time that you have to, you don't have to have another approval by the doctor, or?
Correct.
Okay.
Correct. So disability redeterminations are done based upon how long the physician deems that disability active for. So you'll have annual home visits with your Katie Beckett healthcare coordinator, and quarterly telephone contacts. They're very quick. We're just looking to see if there's any changes in condition, any new medications, any new equipment, mostly to see if you're needing anything or struggling to access something so that we can help you primarily. And again, each child has to meet one of those level of cares. So remember, the process is lengthy. We have typically 90 days, but it's hard to get medical records. And that's one of the barriers we find that we struggle with. And again, you can request 3 months prior medical from the date that application is received in welfare. And that's why you want to do the certified mail return receipt requested, because that's your proof of when that application was received by the welfare office. And remember that no child's ever going to be denied because of a parent's income. The only places that a child can be denied is for not meeting a level of care or for not meeting a disability criteria under the Social Security Blue Book guidelines. And also for non-compliance, like if the family didn't refuse to do an annual home visit or a disability redetermination or failed to do the quarterly telephone contacts. But that doesn't usually happen. I've been doing this for a long time. I've never had that happen.
Laurie, one of our participants would like to know if they have to be connected and established with the regional center before they apply.
No, I'd like you just to contact me, and we'll get everything rolling as quickly as possible. Lots of times we will start if I think we can meet a nursing facility level of care. We'll roll with that and get everything rolling, and then have you work with your regional center as well. So again, remember that Katie Beckett is Medicaid. It's fee-for-service Medicaid. It's the last way for a kiddo to become eligible for Medicaid. So every other category will be exhausted. That's why you start with Social Security, because if you meet that the parent is under the federal poverty guidelines, then they'll get fee-for-service Medicaid through Social Security. The other things to remember is that Medicaid is always a payer of last resort. Many of our kids have primary insurances or secondary insurances, but a lot of things that where the Katie Beckett helps is a lot of these policies are high deductible, and you can use your Katie Beckett before you meet your deductible, and Medicaid will pay, the Katie Beckett Medicaid will pay all of those out-of-pocket expenses before you meet your deductibles. That's super helpful. We also have the health insurance premium payment program. So if parents need assistance with their premium being paid, Medicaid will figure out, they'll calculate if economically it's in Medicaid's best interest to ensure that that child always has a primary insurance. Medicaid can pay for the premium as well. And when you have dual insurance, it's really important to make sure with that private insurance that you're in network, you're seeing an in-network provider, and that provider takes the fee-for-service Medicaid as well. We can help you too here in the district offices. Your Katie Beckett case manager can help you navigate that. And remember, we've got MTM for our non-emergency transportation, meals and lodging. This also includes gas mileage reimbursement. It also includes flights, because a lot of our kiddos need to go to specialty clinics across the country, and MTM will pay for the airfare.
Quick question, if a child already has fee-for-service Medicaid, does that mean they automatically qualify for Katie Beckett Medicaid?
If you have fee-for-service Medicaid already, it means that you don't need to apply for Katie Beckett because you have fee-for-service Medicaid already. You qualified through another eligibility method. Katie Beckett Medicaid is the last way for a child to qualify for Medicaid. And it does that by looking at the child as a separate entity from his or her parents so that the income guidelines are overlooked.
In Vegas, where can families request assistance to complete the application?
You can call me or email me. I'll help you and I'll get you to the right person. There's some frequently asked questions. Who qualifies for Katie Beckett? So Katie Beckett, you have to be under the age of 19. So when kiddos reach age 18 and they're on Katie Beckett, your Katie Beckett healthcare coordinator is going to be getting you ready to apply for Social Security income for that child. And we're going to be working with you all the while to make sure you're keeping good records, have all the medical records, so it'll go nice and smooth for you, hopefully, because it does take time. We actually ask them on that age of that 18th birthday that they contact Social Security and start that process. The next one is Katie Beckett different than Medicaid? No, it's fee-for-service Medicaid, and it's the last way a child can qualify for Medicaid. Is there a cost? There will be that parental financial obligation, but families don't have to accept it. Once it comes out with the costs, you don't have to have Katie Beckett. You can decline it and you can refuse to make the payment and refuse the insurance. And do agencies or providers need permission to bill Medicaid? No, they don't. And if they're a Medicaid provider, they can bill Medicaid. This is an interesting question. Can a child receive the same services from more than one Medicaid provider at a time? And the answer to that is kind of tricky. It is yes. However, if this service requires a prior authorization, Medicaid cannot do a prior authorization for two different providers. So that's important to remember. And your healthcare coordinator, your Katie Beckett healthcare coordinator, can help you determine that.
Was asked a few minutes ago. It was regarding the SSI. I applied for SSI for my son on June 30th. I still don't have an appointment. I called Social Security Friday. They told me to call back today. The local office said they have run out of appointments and I'm supposed to call Social Security again on Friday. Is this typical?
Unfortunately, this is a barrier that we have been seeing during the pandemic. Unfortunately, we were really hoping that this kind of logjam would kind of loosen up as people start coming back, into the world. I'm really disappointed to hear that. Please call me though, or email me so we can make sure that everything else is ready to go. That's what I want to make sure that we've got the MABIT application for Katie Beckett completed, everything ready to go so that we can submit everything to welfare before you get that Social Security denial. Okay, that's what I'd like to do.
When someone said to ask for an abbreviated claim, is that for, I'm assuming, SSI? Carrie?
Yeah, I can help with that. Just because I have a friend who's in the Social Security department and we're going through that process now. So if you ask for an abbreviated claim and tell them that it's for Katie Beckett, they'll get you in faster because that's only like a 10-minute application, opposed to someone who really is trying to apply for the SSI. They already know we're going to be denied, so they do it quicker. So we got our appointment within a couple of weeks, like it's next week, because I was able to ask for that abbreviated claim. So that really did help.
Thank you, Carrie. Yes, when you call SSI, and that's one of the things when you talk to me and in the information I send to you, you will be telling that Social Security worker that you're applying for the Katie Beckett option of Nevada Medicaid and that you believe you're over income. Make sure you have your taxes available as well for that call. This is important, but this gives all the contact information, but is where I would like you to just contact me. I'll help cut out the red tape. I'll help shepherd you and get you started on the application. You'll have the right application. You'll know what you're doing with Social Security. And I can link you to the supervisor in the district office that you're closest to your geographical area. But most importantly, as I said, we can get that application started and rolling, and I can help you if you're having trouble with it as well. I'm available Monday through Friday, typically 8 to 5. If I'm out of the office longer than a day, it will say so on both my email and my phone number as well. And I just want to close out really quickly with something before, because your questions are the most important part of this whole process versus me, talking. But I wanted to share something. When Katie died, Senator Tom Harkin, who's a Democrat from Katie Beckett's home state of Iowa, and he's also one of the chief authors of the Americans with Disabilities Act. He wrote about Katie. He said, Katie is a symbol of what the disability civil rights law set out to establish. Quote, it's about making sure that we don't separate out people with disabilities, but we make them part of the families, making them part of the communities, part of the schools, just an integral part of society. That is what Katie fought for all of her life. And that's basically what I wanted to close out on and answer your questions, because I feel that almost all the parents that I meet in doing my work as a healthcare coordinator in Katie Beckett, you parents are doing all this. You're the champions for your children. You're the best advocates for your children, and you're their heroes. So, and we're here to help you get through the red tape and get this insurance if you're eligible for it.
Wow, you are a gem. I think it's just awesome that you're sharing all this information and your phone number and everything, Laurie. Okay, Casey, you stand by. I'm gonna take a couple of these questions that have been waiting out of the chat. If I need to take my child to a non-Medicaid covered facility, an intensive therapy program, can MTM gas mileage reimbursement still be utilized?
Unfortunately, no, because in order to utilize MTM, the provider needs to be, it has to be either a prior authorized service. I will share with you that we do have kiddos, as I said, who go out of state for specialized services. As long as there's a prior authorization, typically their pediatrician, their primary pediatrician, who is a Nevada Medicaid provider, will put in a prior authorization for this specialty evaluation. So if that service that your child is seeking is not available in Nevada, then potentially, maybe it could be prior authorized. And you could discuss that with your pediatrician. Or call me and we'll see what we can do. And I'll get you to where you need to go.
Samantha said, I have a provider for my son that recently went out of network with our primary insurance. I don't want to find a new one because my son has really bonded with his therapist, and starting over would be very hard. Am I putting his Katie Beckett benefits in jeopardy by continuing to see this provider? The provider has been submitting out of network benefits to our primary for us on our behalf.
That's a very good question. No, you're not, because basically what this provider is doing, if I understand correctly, is that provider may be potentially accepting your primary insurance as payment. They're not billing you for any out-of-pocket amount, but I would clarify with that.
Yeah, I contacted them about it. They went out of network June 1st, and I haven't seen a bill. So I asked about that a couple weeks ago, and that was what they told me. They're like, yeah, we're submitting it to your primary because they already know how to submit it. It's just out of network now versus in network. And so it sounds like it's still in limbo because it sounds like the insurance still hasn't paid it yet.
I think the part that I would want you, Samantha, to clarify is that they're not going to bill you for the remainder.
Okay.
After your insurance pays, you want to confirm with the provider they're not going to bill you for the remainder that's left. that
Okay.
would have been covered if the provider was in network. And is this provider still, is the provider a Medicaid provider?
Yes, they are.
See, and I think that might be a problem, and I'll have to check. I'm going to have to ask somebody as well, because I don't know if they'll be able to bill Medicaid afterward.
Yeah, what they told me was, because I asked about that before they went out of network, and I said, can you just bill Medicaid? And they were like, well, no, because your primary is going to reject it, and then Medicaid is also going to reject it. That was several months ago when I asked him that question.
Sometimes I've had families ask specifically providers if they could stay in network for a particular patient, that they don't have to continue to take people in network, but that if they would be willing to stay in network for your case. You may
Okay.
also ask them if they would be willing to consider that, but be very careful. I want you to make sure you understand whether or not they're going to bill you for the remainder.
I guess my question is, if they do, is that bad? Like if I pay that, or is he going to lose his Katie Beckett?
I see the problem is see, they can't legally, under the Centers for Medicare and Medicaid Services, they cannot collect money from a Medicaid recipient.
Okay.
So they will have to accept what your insurance is paying out of network technically.
Okay.
Does that make sense?
Yeah, it does.
Okay. And if you have problems or if the provider has questions, they can call me and I can link them up to the people who can help them navigate this.
Okay, thank you.
Well, will Katie Beckett pay if it's out of pocket? If it's out of network, they bill that, they pay for out of network, and then they bill Katie Beckett Medicaid. Will Katie Beckett Medicaid not pay that?
I don't think so, because it's out of network. Remember that the primary insurance, and it has to be in network. Remember, that was one of the clauses. You have to make sure that your providers are in network. I think she will be okay if the provider, and I would want this in writing, Samantha, is willing to take what your primary insurance pays out of network as full payment to protect you.
Okay. Yeah,
Okay.
that's good information. I'll give him a call tomorrow and find
Okay.
out. Thank you.
You're welcome.
All right, a child with autism has dual insurance, culinary. Parents got notification from insurance that they will stop ABA therapy since child is turning 6 in October. Culinary provides ABA service up to age 6. Can parents apply for Katie Beckett to continue providing the services to the child?
Does the child already have Katie Beckett? Or just culinary?
No.
Okay, definitely put your application in, email me, and we'll get everything out to you and you can start that right away. So hopefully we don't have a gap in your ABA services.
Okay, Casey asked that we go back to page 13. So Matt asked, have you reached out to the social workers in the local NICUs and given them your contact information? When we left the NICU at Sunrise Hospital in 2019, Katie Beckett was recommended, knowing we wouldn't qualify for SSI, but no resources or direction on how to get it was provided. If I would have had your contact information in the beginning, I wouldn't have given up on trying to get through the process at that time.
I'm sorry to hear that. Hopefully I can still help you if your child is under the age of 19.
The social workers now have your contact information at the hospitals.
We were really pre-pandemic starting to really want to do a road show, do the Katie Beckett road show with our NICUs and with our pediatricians' offices as well. And unfortunately, due to the pandemic, that has not occurred. I have a good relationship with a lot of the NICU social workers in the Reno, Carson area, but I do not in the Las Vegas area. And that is something we definitely need to work on. We do rely very heavily on Nevada Early Intervention Services. They're very critical, to us as a sister agency, and also to our our regional offices, Desert Regional Center, Rural Regional Center, and Sierra Regional Center as well. We really rely on them as well to help us reach out to people. And Diana has been instrumental as well in starting to really, bridge some of the gaps that we've had in helping parents navigate all of this.
Thanks, Laurie. Is there any news on if Katie Beckett will cover ABA services for individuals who do not have autism? Maybe if they have a different disability?
That is a very good question. And that is a question that I had another parent ask me that just recently, that they told me that their child was receiving ABA services for other than an autism diagnosis. And that is something that I will have to work on, Diana, and get back to you to have me post that answer. Or if that person could also email me too as well.
Okay, yeah, that would be great. And we can send these out too, once you get the answers. I know this question is a bit unrelated, but is there anywhere we can find a current list of medical providers that accept Medicaid, fee-for-service, Katie Beckett, etc.?
Oh, goodness gracious. That is also a barrier that we face as here in Medicaid in the district offices. There is a list, and if you email me, I can show you the list, or I can actually give the information. Diana, I'll give the information to you as well. However, this list is not easy to navigate, unfortunately. I would have hoped that it would have been easier. We, even as healthcare coordinators, struggle to navigate the list, and the list is inaccurate. It's not live. It's not a live list. So many times I'll do a provider search. I'll get up 20 providers in a location, and I'll call them, and maybe 2 or 3 of them are still Medicaid providers. So that is something that we're struggling, to overcome. So help us, we'll help you contact your, once you're on Katie Beckett, we can help you find a provider. We can crisscross, we look at your primary insurance list in network, and we can crisscross it, and your healthcare coordinator can call the Medicaid providers that we see and find out where they cross, so we can get you connected.
Laurie was nervous. You're amazing.
It's my first one, everyone. It's my first Zoom, and I was really stressed out about it. But I thought to myself, I'm here. This is what I do every day. Is helping people, helping you, and I'm just gonna do it like you came into the office like a parent and said, I really need help. And I'm really glad for this opportunity again. Thank you so much, Diana and Travis, for your help. I really appreciate it.
We got a lot of really positive comments for you here, and we did have a message. I don't have a lot of luck with the list that the doctor's office has. I always just started calling doctors, specialists, and therapists until I find ones that take fee-for-service. So that is one way to do it too.
Well, and if you have a Katie Beckett case manager, your Katie Beckett case manager can help you do that. That's part of our jobs, is to help get rid of that red tape and, help you to navigate and access providers without barriers. That's what we're trying to do.
Do want to give a quick shout out. We have Kamala, and I saw Marcia was on here. They're family navigators with the Family Navigation Network here at the Nevada Center for Excellent Disabilities. And they are also out there to help you with any healthcare navigation that you might have or need, finding a doctor or a therapist or other
and if
things.
we can help them too, Diana, as well. If they need to contact me, I'm happy to be a resource to them as well.
Okay, Marcia, Kamala, did you guys hear that? That's just super awesome. Kamala said, do we have a coordinator that can help us if we don't have Katie Beckett, but have fee-for-service Medicaid?
Call me. I'll help you.
All right.
May I ask a question?
Sure.
Yes, please.
Yeah, thank you so much. My son, he just was recently diagnosed with autism and he's 2. We currently have HPN Medicaid, but it expires the end of October. I'm in a limbo. Do I apply now for SSI? Will they allow me to apply even though I have HPN Medicaid, but it's expiring the end of October? And I believe we are over income, but they just extended the HPN Medicaid due for COVID reasons. So we got lucky.
Go ahead, email me, and I'll send you everything that you need to get started for the Katie Beckett application. And Contact SSI, tell them you need, to do the abbreviated, version because you're applying for Katie Beckett. Your Health Plan of Nevada ends on October the 1st, and that it's going to take some time for the Katie Beckett to kick in, and if they could facilitate that.
Okay, great. Thank you so much.
I look forward to your email or your call.
Thank you. Thank you.
You're
You've been
welcome.
very helpful, so thank you.
You're welcome.
Marcia, will you unmute and say what is FNN, Matt asked?
Yes, I'm on here still. I'm actually in my backyard, so forgive the scenery here. So the Family Navigation Network is a project of the University Center for Excellence in Disabilities. It is our state's family-to-family health information center. So we are here to support anyone who has a child or a youth with special health care needs and providing any kind of assistance around healthcare, whether that's navigating through systems like Medicaid, which and Laurie, we love you so much. Right, so finding how to pay for healthcare, finding healthcare providers, finding other sources of support around healthcare, that's what we're here for. So if you guys are interested, I put my email in the chat here. You can email me directly, or you can just go to our website. And I think Travis is going to put that in the chat as well. So you can go there. We have a referral form directly on the website, so you can fill that out. And within a day, one of us will reach out and see if we can help you out.
Well, I'll send your information out in the email as well. And yes, this is a statewide, Family Navigation Network is statewide, and we have family navigators in Las Vegas. And it's all the same contact information, and they get you connected with somebody in your region. He will be.
Thank you, Travis. Perfect. And Kamala is our other navigator up here in Northern Nevada, but we also have one in Southern Nevada and one out in the rural. So we cover the entire state. So no matter where you are, we'll be able to connect you to whoever you need to connect with or whatever resource you might need. So thanks for the shout out, Diane.
Mm-hmm. Yes, thank you for being here. I appreciate that, Marcia and Kamala. And Laurie, this has been so wonderful. I just want to thank you on behalf of everyone who's been here and on behalf of the people in our state. I just want to cry. I'm so happy that we were able to provide this information for families. I'm a parent as well, and I know it's a struggle to get the information that you need, and to have a connection like this is just so valuable. And so thank you so much.
Thank you for having me all. Thank you.
And yeah, thank everybody for taking your time out of your summer to be with us. I do want to do one plug, or have our next summer webinar series on August 10th on supported decision making. And we have Alexander Cherup from the Nevada Legal Services, as well as Hank Cavallera is going to be here talking about it. That one's going to run an hour and a half. They wanted a little extra time for questions, so we're going to have a lot of information. And our last one will be on August 24th on routines and transition, and that's for all ages, which is going to be really great. So those, you'll be seeing those come through your email box with the information from this webinar. And Laurie, would it be okay if we are going to be sending this PowerPoint out to the participants?
I think so. That should be fine.
Okay, I'll be sending the PowerPoint out as well as some other information. And thank you everyone for being here.
Great.
Thank you, Laurie.
Have a good night, everyone.